Okay, good morning. Hope everybody had a wonderful Thanksgiving weekend. Today, we are pleased to be joined by the Office of Drug Control Policy Director, Steve Lucan, who is here to discuss a very important topic that is affecting many states across the nation, including Iowa. We want Iowa to become the healthiest state in the nation. And part of that goal is ensuring that Iowans with drug or alcohol addictions have access to necessary prevention, treatment, and recovery programs. Across the nation, the opioid epidemic has become an increasing challenge. In Iowa, we've seen emergency room visits related to opioid abuse increase by over 230%, and opioid related deaths more than triple over the past decade. What makes opioid abuse through heroin or illicit fentanyl products different than other drug or alcohol abuse is its potency. Too often, Iowans are becoming addicted to prescription drugs and turning to heroin or illicit fentanyl to continue their addiction because they are cheaper and more easily accessible. While treatment and recovery options are available to Iowans when heroin or illicit fentanyl is consumed, their potency sometimes is too powerful and results in death quicker than anyone can expect with a drug addiction. To combat this and stabilize anyone with opioid overdose, a prescription drug called naloxone can be administered. Last spring, I signed into law a bill that improved access, possession, and administration of naloxone. As a result of that law, eligible Iowans, including first responders, family members, or friends in a position to assist an at-risk person, can gain access to administer naloxone. Naloxone can be administered in 4 different ways to reverse an opioid overdose. Naloxone is not a cure. However, it will help stabilize an individual with an opioid overdose until they can get emergency medical treatment. In order to further improve naloxone access, our state's medical director at the Iowa Department of Public Health, Dr. Patty Quinless, recently issued a standing order for naloxone. Eligible Iowans can go to their local pharmacy and fill out a proper paperwork to get naloxone. A standing order means anyone who demonstrates a need for naloxone can get it without having to go to their primary care doctor or other prescribing healthcare professional. This naloxone standing order follows the lead of nearly 30 other states. Naloxone is only effective when a person is experiencing an opioid overdose. Therefore, side effects are rare. Improving access to naloxone is a critical step to combating the opioid epidemic. I'm proud that our state agencies have worked diligently in a collaborative manner to make this possible. Now I'd like to turn it over to Lieutenant Governor Kim Reynolds to tell you more.
Well, good morning. Thank you, Governor Branstad. As we travel the state, we hear from Iowans about the increasing challenge faced with opioid addiction. The opioid epidemic requires a multifaceted approach, including prevention, treatment, and recovery. At the state level, we are engaging state and local officials to improve naloxone access and ensure Iowans know about prevention and treatment options for opioid abuse. In addition to the standing order the governor mentioned, the Department of Public Health has recently published an educational brochure helping Iowans recognize and respond to opioid overdose. First responders, along with family members and friends to someone at risk for an opioid overdose, are all encouraged to become aware of naloxone, gain access to it, and how it is administered. Recognizing and responding to the opioid overdose can mean the difference between life and death. Once a patient is stabilized from an opioid overdose, treatment is necessary. Iowans with opioid addiction can find treatment options at drugfreeinfo.org, where they can identify an appropriate healthcare provider that's in their area. In addition to expanding naloxone access and identifying treatment options, there are several ongoing efforts to in state government to combat the opioid epidemic, including specialized opioid treatment through local healthcare providers with the help of federal grants, our prescription drug monitoring program tracking controlled prescription drug abuse in the state, professional training and education by our licensing boards and teaching hospital, and our expanded prescription drug take-back program, which we had the opportunity to highlight last month for National Prescription Drug Take-Back Day. We continue to take a collaborative approach to the opioid epidemic, and we are very appreciative of this work led by the Governor's Office for Drug Control Policy, along with the Iowa Department of Public Health, Public Safety, Human Services, the Iowa Board of Pharmacy, the Board of Medicine, local government and law enforcement, the healthcare provider community, as well as associations such as the Iowa Pharmacy Association. So we appreciate all their efforts in collaboratively addressing this. And now I'd like to invite Steve Lukin to the podium, who's the director for the Governor's Office of Drug Control. Steve?
I would like to thank the governor and lieutenant governor and other members of the administration, all the team that's present here today for all the good work that has been happening, and also the press. Recently, the governor and lieutenant governor took opportunity to highlight the prescription drug take-back efforts in our state. We saw phenomenal turnout by Iowans. Iowans participated strongly. We don't have the final nationwide tallies, but we're clearly in the top 3 states who have participated in the total pounds taken back. And that is another angle to this. This is an important piece of helping get these powerful painkillers out of the supply chain. And I think it's also a good opportunity. We would really like to stress at this time with the holidays and ask the press to again share things that the lieutenant governor highlighted, the drugfreeinfo.org website, for example. Many Iowans out there just don't know where to begin. They see something happening in their family. Treatment for them, for example, is very confusing. They don't know where to start. There's resources on that website. There's actually searchable databases that are available to help people find options nearby. And maybe sometimes there's multiple options that are out there. So there's a lot of good resources available. We think it's important to have these conversations in the home as well. A lot of our data and research we've shared in the past will tell you that if families take time to have conversations to prevent drug abuse, kids growing up in those homes are far less likely to experiment with drugs and alcohol, and we can help prevent some of these problems before they get out of control. So we have a lot of good things going on in the state we're proud of, but clearly a lot of work to do, and we thank the administration and all the other partners helping to push these efforts forward.
Okay, we'd open it to questions on this subject first.
Do you think that all the various programs that the governor mentioned, is that enough? Are you going to be recommending anything else?
We're going to be continuing to look at things we can do to improve public safety. We've had a group that's looked at, we've had an increase in traffic accidents. Some of these are substance abuse related. So we're going to be reviewing the different ideas and recommendations that are coming from the working group and others. And I will be addressing that in the condition of the state address. So we're going to be continuing to look at other things that can be done, but this is something that we think makes sense and can save lives. And we want to make sure that we're doing all we can. I would point out methamphetamine continues to be even a bigger issue in Iowa than heroin. So we need to continue to be vigilant in that front as well. Other questions?
Well, as long as you're talking about this, you're aware that Obama has released a lot of nonviolent drug offenders. Have you got any thought about that on a state basis? Have you got any thought about like community? I think the number is like 1,000 or something like that Obama said. Have you thought about doing that for nonviolent offenders?
Well, first of all, the parole board and corrections have worked together in a collaborative way, and we have seen a significant reduction in our prison population through that, and we have indeterminate sentencing. Unlike the federal law, which has a very rigid system where they have to serve, I think, 80%. So our system is much different than theirs, and I think the Board of Parole has, in collaborating with corrections, has been able to identify those people that are good risks. So I think our system has worked well. I don't think there's a need to do a massive pardons or commutations. Other questions on this subject?
What is the next step? There've been a couple of initiatives against the drugs, cold flu drugs, and that's been pretty effective. Is there another step you're envisioning?
Well, we're going to be looking at, there's a task force that's been appointed by the Commissioner of Public Safety, and we're going to be looking at the recommendations coming from that group, as well as listening to others that have suggestions or ideas and how we can do a better job of protecting public safety. And, we'll be reviewing all of those ideas and recommendations. And I intend that that'll be one of the areas I'll address in the condition of the state address. Well, if there are no further questions on this subject, we'd open it to other subjects as well.
There are 18 states in the District of Columbia that have laws on the release of police videos. There's a conflict now in Cedar Rapids whereby the Lynn County attorney says the video can't be released based on Iowa's public information, public records law, and the board says it can be. Do you intend to recommend any standards or changes in Iowa's open records law to specifically deal with police videos, which are becoming more important to in the pursuit of criminals and for families who are involved?
Well, as you know, this is kind of a recent development of these police cameras. And I think it would be appropriate for us to carefully review our laws. The Iowa Public Information Board was established to really be able to answer questions that come up on this subject. So they certainly are the appropriate area where, whether it's police departments or the general public or the media, should go to try to get an answer. But if there's a ambiguity or if there's areas that need to be clarified, then it may require legislative action. So that's something that I think we need to carefully look at and determine what would be appropriate to, again, protect the public safety but do it in a way that's fair and even-handed.
In the interest of transparency, do you think you should err on the side of always releasing them except in certain circumstances?
Well,
Whereas others would say never release them unless there's a special circumstance.
well, here's the thing. When we're looking at these kind of videos, they oftentimes involve a criminal investigation. And so you don't want to release prematurely items that are important for a criminal investigation. So you have to be very careful about that. I think that is in the law right now as an exception. And so that's the reason why this is, generally we want the public, we want these things to be released. But when it comes to criminal investigations, that's a different subject. And we don't want to jeopardize the ability to get a conviction by prematurely releasing video. Yes.
Governor, just as the issue of health insurance had been,
Yeah.
for public employees, had been a significant concern of many Republican legislators
Right.
over the years. Many Republican legislators over the years have also expressed concern about ICR's pension system, and they suggested that Iowa should, instead of continuing the defined benefit program, which you're aware of how that works, should instead go to a 401k type of program for future employees, similar to a defined contribution program. Have you got any thought about that?
Well, many companies in the private sector have years ago made that transition from a defined benefit system to a defined contribution system. However, that is a significant step that is, there has to be a transition and all of that. So certainly something worth studying, but it's not something that I would expect would be something that could be addressed in the near future, because it's going to take a substantial study, and you need to know what the financial impact and the impact will be. First of all, you want to protect those people under the present system so that their benefits are protected. And the ones that have gone that way have to a great degree changed the system for new employees as opposed to the ones that have been under the system. So I'm open to considering changes, but I want to assure people that we're not looking at eliminating anybody's benefits or changing it in a way that would create financial hardship. So it's a complex, a difficult issue. A lot of people feel that the defined benefit system is not sustainable in the long term. But Iowa does have one of the best defined benefit systems under our IPERS program of any of the states. So certainly ours is better run than most states. We're right next to Illinois, which has the worst unfunded pension system in the country. We've seen what's happened there. We've seen what's happened in other states, New Jersey, and I mean, you can go on and on. Actually, Rhode Island, I think a few years ago, did address this issue, and the state treasurer who was a leader in that guy actually became elected governor. So there are states that have addressed it, but it's a challenge, and it's an issue that I think is something that needs significant study and research in order to know what the implications are of making a change of that magnitude.
In the opening round of contract negotiations with the State Police Officers Council, management offered 1% pay increase in each of those two contractors, whereas with AFSCME there was zero, as well as the no insurance included. What has been your sort of marching orders to the lead negotiator for you in terms of what you want to see?
Well, we want to negotiate in good faith. And with regard to health insurance, we're exploring the idea of trying to, right now, I think there's over 500 different contracts with public employees at cities, counties, school districts, and the state with regard to health insurance. And especially for a small unit, a small city or county school district, if you have just a few people that have significant health costs, it drives the premiums through the roof. So going to a large statewide contract comparable to what we have with IPERS, where everybody is covered with the same system, we think can save a lot of money and provide quality insurance coverage for all the employees, and do it in a way that both protects the health insurance and the coverage, but at the same time reduce costs dramatically at a time that we have some significant budget issues. So I think it's appropriate that we see if that can get done. We're in the process of studying and reviewing it at the present time, and I'm very hopeful that it can be an issue that can be addressed this coming session.
Mayor, are you interested in major changes to Iowa voting procedures, such as voter ID, other things that people say are needed to protect the integrity of voting systems?
Well, first of all, I want to compliment our Secretary of State and our county auditors. I think that they do a good job of protecting the integrity of the voting system in our state. But I always think we need to be looking at things we can do to make it better, to make it more fair, to make sure that it's accessible, but that we prevent fraud. And I'm interested in working with the Secretary of State, working with the auditors, working with the legislature to see what kind of changes would make sense for the future. I know the Secretary of State uh, feels there needs to be some money invested in this system. There was some federal money that's long since gone, and so to have the kind of uh, quality, uh, fair, and um, system that protects the integrity of the ballot box, we need to continue to look at what we can do to improve it.
To put any investment into it this year?
Well, it's a tough year to do that, so it's not going to be easy. I know that I've had private conversation with the Secretary of State, and I know that he has some requests. I think we will hear it in his budget presentation, and we will consider that along with everything else as you know, I have to present a budget that is balanced, and it's got to be balanced based on the December revenue estimate. And as of now, based on what happened in October, we think that's going to be a pretty austere situation. So we have to, well, no, we haven't made the decision. We haven't even heard the presentation, and we have to look at it. But it is what we can afford to do, and I'm open to looking at things we can do. But it is important, and I agree with the Secretary of State. We want to protect the integrity of the ballot box.
Has the Secretary of State's office said that there's an issue with the integrity of voting in Iowa? Or is it
No,
specific to
they have
Iowa?
concerns. They have concerns that we need to make some additional investments to protect the integrity of it. But I think the Secretary of State's office says, and the auditors generally across the state, they have worked very diligently to try to protect the integrity of the system. That's not to say we don't have people that try to cheat, because we do, but they've done a good job, and I think have been able to run a very fair and good system. We want to keep it that way. We want to continue to improve upon it.
Do you have any specific ideas about what kind of changes you'd like to see if there is any issues over the integrity of voting in Iowa?
Well, I really think the people that directly work on it on a day-to-day basis, the county auditors and the Secretary of State's office, are the best to, to give us their ideas and their suggestions of where they see problems and how they can best be addressed. So I'm interested in working with them, and I understand it's also something that we need to work with the General Assembly on as well.
Got time for two more, Bill and then Joyce. We've asked you a bunch of times about possibly being in the Trump administration, but I just want to ask about other Iowans. Are you hearing anything about other Iowans? There are a lot of Iowans who played significant roles in the Trump campaign, including your son, people like Tana Gertz and Sam Clovis, and other people. Are you hearing anything? Do you expect them to be, Iowa people to be participating outside of yourself? Do you expect Iowa people to be participating in the Trump administration? Are you hearing anything?
Well, I wouldn't be surprised if there would be Iowans chosen for key positions, because Iowa played a very important role. And Trump carried 93 of Iowa's 99 counties. He carried Dubuque County, which no Republican presidential candidate had carried since Eisenhower in '56. And he carried counties like Wapello and Lee and Des Moines and Jasper that historically have not been Republican. So I think Donald Trump is very appreciative of the unified effort going from the elected officials and the party leadership. I want to say that our party chairman and co-chairman and national committee man and committee woman, both senators and the congressional delegation, our legislators and the lieutenant governor and I, we all worked together, and we were rewarded with a great victory that not only in the presidential election, but with Senator Grassley's a huge re-election victory, and all of our congressmen winning by substantial margins, and then defeating 6 incumbent Democratic senators and picking up 2 House seats. It wasn't a bad year. I guess I'd say it was a great year, but it didn't happen by accident. It happened because we were united, we worked hard, we recruited great candidates, and there was a unified effort that went on, just like we did in 2014. And I said, you know, I want to do what we did in 2014 and 2016, and I wasn't on the ballot. But I said, I'm running vicariously. I'm trying to, and the lieutenant governor and I went all over the state, and we did events for all these legislative candidates and with our congressional candidates. And I had the honor of introducing Senator Grassley and his wife on a number of occasions. So it was fun. And I'm expecting that there will be Iowans that will be chosen to be part of the new administration.
Back on the voter integrity issue, President-elect Trump tweeted that there were millions of illegal votes cast. I think there's just way too much exaggeration from your party on the danger of illegal voting.
No, I think it's a serious thing. And the integrity of the ballot box is something that has to be protected. I find it kind of interesting when the other side challenges the outcome as they are in Wisconsin. That's okay. But if our side says something for some size, and you know, if Trump had done that, my God, can you imagine the way they'd come down on him? But it's a different situation, I guess, if it's the other side that's challenging the results. Generally speaking, I know that in Iowa, they work very hard to protect the integrity, but I understand there are some issues. I've heard it in North Carolina. I've heard it in other states. There's a very, there's a contested, or there's extremely close governor's race in North Carolina, and there's been significant allegation of voter fraud there that is presently, I think, being reviewed. So, and I'm not familiar with all the different allegations in the different states, but it's something that we have to be very vigilant about.
Can you get the master contract of healthcare done by the end of February? Because that would be the deadline for all the state contracts.
Well, certainly we want to look at what's the art of the possible on that and the impact that could have on the state budget as well as on cities, counties, and school districts. I think there could be, I think it's possible, but it's obviously going to take a vigilant effort. But as of now, we're just at the early stages of this, and we don't know exactly what the impact would be. But I certainly have felt for a long time that something like this was needed. But it does take a change in the law in order to be able to implement it. But just think about it. You know, if you have a whole bunch of 500, I guess it's over 500 different contracts, if you can have one big master contract and spread that risk, that's the whole concept of insurance, spread the risk, that can be substantial savings.
Thank you, Governor.
Thank you.